Did you know that some of the most common beliefs about glaucoma could actually harm your vision? And what if I told you that understanding the truth could help you prevent blindness? In this video, we're uncovering the biggest myths about glaucoma, revealing the facts you need to know to protect your eyes, and sharing tips that could save your vision. Glaucoma is a leading cause of blindness worldwide. And what's alarming? It can sneak up on you without any warning signs. Imagine this: your vision deteriorates slowly, so subtly, that by the time you notice, irreversible damage might already have occurred. This is why glaucoma is often referred to as the silent thief of sight. But let's not panic, let's educate ourselves. This video is all about shedding light on glaucoma myths, revealing the truths that can protect your vision, and giving you actionable eye health tips. Myth 1. Glaucoma only affects the elderly. When you hear the term glaucoma, what comes to mind? For most people, it's an image of an elderly person struggling with vision problems. While it's true that the risk of glaucoma increases with age, believing it's exclusively an old person's disease is both misleading and dangerous. Here's the truth: glaucoma can affect anyone, regardless of age, even children. Yes, that's right. Infants, teenagers, and young adults are not exempt from this condition. Take congenital glaucoma as an example. This rare but serious condition can appear in newborns and infants due to an underdeveloped drainage system in the eye, causing increased pressure. The symptoms might include sensitivity to light, excessive tearing, or an enlarged cornea. And it doesn't stop there. Teens and young adults are also at risk, especially with conditions like juvenile open-angle glaucoma, which can develop without warning. These cases may not grab as much attention as those in older adults, but they highlight why glaucoma isn't just tied to aging. Still skeptical? Consider the numbers. Around 2% of the global population over 40 is diagnosed with glaucoma, which reinforces the misconception that it's solely an older adult issue. But let's not ignore the younger population. Though cases in people under 35 are rarer, they do happen, and they're often discovered too late due to a lack of regular eye exams. This oversight can lead to preventable vision loss, showing why it's critical to debunk this myth and take a proactive approach to eye health. What can you do? The solution is simple yet powerful: regular eye checkups. Parents should ensure their kids' routine health screenings include eye exams, especially if there's a family history of glaucoma. Teens and young adults shouldn't wait until they experience symptoms or reach middle age to see an eye specialist. Vision is invaluable, and early detection is the key to avoiding complications later in life. Now, if glaucoma isn't just about age, you might wonder, can it be prevented? Let's dive into that next. Myth 2. There's no way to prevent glaucoma. Let's address another big misconception: the idea that glaucoma can't be prevented. This belief has left countless people feeling powerless, but the reality is quite the opposite. While you can't erase risk factors like genetics or age, there are proactive steps you can take to reduce your chances of developing glaucoma, or catching it early enough to manage it effectively. First, regular eye exams are your secret weapon. Think of them as an early warning system. Eye doctors don't just check your prescription, they measure intraocular pressure, examine the optic nerve, and perform visual field tests, all critical for detecting glaucoma early. If you're over 40, aim for an exam every 2 years, or annually if you're at higher risk due to family history or other factors. Here's an example. Imagine catching a leaky faucet early versus letting it flood your house. That's the power of regular eye checkups. They allow doctors to identify subtle changes long before you notice symptoms. But exams aren't the only thing you can do. Lifestyle changes also play a big role. Maintaining healthy blood pressure and cholesterol levels is key because circulation impacts eye health. For example, eating a diet rich in leafy greens, fatty fish, and nuts isn't just good for your heart, it's great for your eyes too. And let's not forget protecting your eyes from UV rays with sunglasses. It's a small step that can prevent damage over time. Combine that with cutting back on smoking and managing stress, and you're building a strong defense against glaucoma. You might be wondering, if I'm doing all of this, what else could be causing glaucoma? That leads us to our next myth, because eye pressure isn't the only culprit behind this condition. Myth 3. Eye pressure is the only factor in glaucoma. When most people think about glaucoma, the first thing that comes to mind is elevated eye pressure. It's no surprise, as this is one of the most well-known risk factors. However, eye pressure is just one piece of a much larger puzzle. Glaucoma's development involves a complex interplay of factors, including genetics, blood flow to the optic nerve, and even immune responses. While elevated intraocular pressure is significant, it's not the sole determinant of whether someone develops the condition. Let's use a metaphor. Imagine a tree with a weak root system. Even if the branches and leaves appear healthy, the tree is at risk of collapsing when conditions change. Similarly, your optic nerve might already be vulnerable due to poor blood flow or genetic predisposition, even if your eye pressure seems normal. This is why some individuals with high eye pressure never develop glaucoma, while others with seemingly normal pressure experience significant damage. Genetics also plays a leading role. If glaucoma runs in your family, your optic nerve may be inherently more fragile. Combine this with factors like poor blood circulation, often linked to conditions such as hypertension, diabetes, or smoking, and the risk increases dramatically. These elements act together, silently undermining the foundation of your vision. Think of them as hidden culprits, working in the background to make the optic nerve more susceptible to harm. This is why comprehensive eye exams go beyond measuring pressure. They include a thorough evaluation of the optic nerve, blood vessels, and overall eye health. Ignoring these additional tests could lead to a false sense of security or even a misdiagnosis. Now, if eye pressure isn't the sole factor, you might be wondering, does having glaucoma always mean vision loss? That's a critical question we'll tackle next as we explore another common misconception about this condition. Myth 4. Glaucoma always causes blindness. The word glaucoma often sends shivers down the spine, conjuring fears of inevitable blindness. And while it's true that glaucoma is a serious condition, let's set the record straight. Blindness isn't always the end result. In fact, most people with glaucoma who receive early diagnosis and proper treatment are able to retain much, if not all, of their vision. The key lies in awareness and timely action. Why does this myth persist? The answer lies in the nature of glaucoma. It's a progressive condition, meaning the damage builds gradually over time. Left untreated, it can start by affecting your peripheral vision and, in severe cases, reach your central vision. However, thanks to advancements in modern medicine, we now have tools to slow or even halt this progression. Early detection is crucial because the sooner glaucoma is diagnosed, the more options you'll have to protect your eyesight. The first line of defense typically involves medications, such as eye drops, designed to lower intraocular pressure and reduce stress on the optic nerve. In cases where medications aren't enough, procedures like laser therapy or surgeries, such as trabeculectomy, can effectively manage the condition. While the thought of surgery might sound intimidating, these treatments have helped countless individuals maintain their vision. The takeaway? Glaucoma can be managed, and blindness isn't a foregone conclusion. Lifestyle changes also play a critical role. Managing stress through meditation or yoga, incorporating physical activity, and eating a diet rich in antioxidants can bolster your eye health. Think about adding blueberries, spinach, walnuts, and fatty fish to your meals. These foods are packed with nutrients that support the optic nerve. Small, consistent changes can significantly improve your treatment outcomes. Remember, having glaucoma doesn't mean you're racing against time to inevitable darkness. With vigilance, the right medical care, and a commitment to healthy habits, you can enjoy clear vision for years to come. But this raises an important question. What steps can you take today to safeguard your eyesight? Let's dive into some actionable tips in the next section. When it comes to protecting your vision, a proactive approach is your best bet. The good news is that small, consistent habits can make a big difference. Let's explore some actionable tips to help you safeguard your eyesight and reduce your risk of vision loss. First and foremost, regular eye exams are non-negotiable. These aren't just for people with glasses. They're essential for everyone. Aim for a checkup every 2 years if you're under 40, and once a year if you're older or at higher risk for glaucoma. During these exams, your eye doctor will test for early signs of glaucoma, measure intraocular pressure, and evaluate the overall health of your eyes. Think of it as an investment in your long-term vision. Next, let's talk about nutrition. Your diet plays a significant role in maintaining eye health. Foods like kale, spinach, and other leafy greens are rich in lutein and zeaxanthin, nutrients known to support the retina. Fatty fish, such as salmon, is packed with omega-3 fatty acids, which promote healthy blood flow to the optic nerve. For snacks, try nuts and seeds. They're excellent sources of vitamin E, another vision protector. Managing chronic conditions like diabetes or high blood pressure is equally important. These conditions can damage blood vessels in your eyes, increasing the risk of vision problems, including glaucoma. Staying on top of your overall health is a key component of your eye care routine. Lifestyle tweaks also go a long way. For instance, stress management isn't just good for your mind, it's great for your eyes too. High stress can spike your blood pressure and harm your optic nerve over time. Practices like yoga, meditation, or even a daily walk can keep stress levels in check. Don't underestimate the importance of UV protection. Sunglasses aren't just a fashion statement. They're essential for blocking harmful rays that can contribute to cataracts and macular degeneration. Look for sunglasses labeled with 100% UV protection for the best coverage. Finally, be alert to warning signs. Sudden vision changes, eye pain, or persistent headaches shouldn't be ignored. These could indicate serious eye issues requiring immediate attention. Remember, it's always better to catch problems early. By incorporating these habits, you'll not only reduce your risk of glaucoma, but also boost your overall eye health. And speaking of healthy habits, there's always more to learn. So let's recap. We've busted some of the biggest glaucoma myths, uncovered the truths that can protect your vision, and shared powerful, practical tips to help you prevent blindness. From regular eye exams to small lifestyle changes, these steps could make all the difference in preserving your eyesight. If this video helped you see things more clearly, make sure to give it a thumbs up, share it with someone who needs this information, and subscribe to the channel for more eye health tips that could change your life. And don't stop here, there's so much more to learn. Click the video on your screen now to discover the best foods to supercharge your vision.